I think a lot of people ask me about what are the steps for the parathyroid surgery. So the way we do it in most of the places that I operate is that you come into the surgery center or the hospital to be done as an outpatient. Once you show up from surgery, of course, you can't eat that morning, so nothing by mouth since midnight. And then in the preoperative area, you'll see the anesthesiologist, you'll get an IV placed, and at that time we often send a baseline PTH level. Once we go back to the operating room, you're put to sleep through that IV, and then once you're fully asleep, the breathing tube gets put in, and we put it in with a video laryngoscope so that I can watch where the nerve monitoring endotracheal tube is placed to make sure that it's in the correct position. Once that's in place, we often place a second IV to get blood draws that are going to be needed for the PTH levels during the surgery. After I remove your bad parathyroid gland or glands, I'll check your blood levels to make sure that your parathyroid hormone level, PTH, goes back to normal. That has a half-life of about 3 to 5 minutes, so we should know pretty quickly whether you're cured or not. So after the second IV is in place, we usually get you positioned, and then we clean you off and get sterilizing liquid on the area that we're going to cut. It's injected with local anesthesia, provides some hemostasis to prevent bleeding, as well as some local anesthesia for postoperative pain. And then a small incision is created there, and I'm able to go down and push the thyroid out of the way to get down to the parathyroid glands, find the bad one, hopefully find the good ones as well, and then have some idea of what's going on with all 4 glands. At that point, I would check your blood levels, and while those labs are into the laboratory getting processed, we'll close the skin in multiple layers with dissolvable stitches. Those are convenient, so you don't have to have anything removed. And then once the skin is closed and looks perfect, you close put a little bit of glue on the top and some sterile tape, and that hides the incision and keeps it waterproof so that you can shower afterwards. In the meanwhile, we're waiting for the blood levels to come back from the laboratory, and as long as they drop back into normal range, the anesthesia team will then remove the breathing tube, wake you up, and send you to the recovery room. Usually within about 30 minutes, you're already drinking in the recovery room, and as soon as that point is good and the nurses feel confident that you're safe to go home, they'll send you home. That night, you can have a light diet. You have some anti-nausea medicine in case there's any lingering effects from the anesthesia. And then the next day when you wake up, you can have whatever you like.